Well, welcome back, everyone. Today we're exploring alternative pain management options with Dr. Aleksey Prok from Lima Memorial Health System. So specifically, we're actually going to talk about pain management without opioids. So thanks so much for joining us, Doctor.
Good morning. Thanks for having me.
Yes. Well, firstly, what are the main challenges that are in managing chronic pain without using opioids?
Well, the challenge is we really don't have a great tool that allows us to provide immediate pain relief for most of the occasions. So whatever we're offering our patients will have to be kind of, you look for a future benefit instead of immediate relief.
Okay, so can you explain maybe some of the non-opioid treatment options that are available for chronic pain management?
There's a million options available. Physical therapy, exercises, massage, chiropractic, tissue manipulation. There are multiple medications that we call adjunct because we usually use them along with pain medicine, such as anti-inflammatory medication. Some antidepressants are good for certain conditions. Some anti-seizure medication are approved by FDA for treatment of chronic pain. Muscle relaxants. Recently, medical marijuana has been approved for treatment of some of painful conditions.
Yeah, so that's a lot of options. So how do you determine the best course of action for a patient when opioids aren't part of the treatment plan?
Well, I guess the frank conversation with patients, possible allergies, patient's preferences, maybe success with the previous treatment options, etc. A lot of times patients come and talk to you and they base their treatment decisions on experience in the family and so on. So generally you try to be supportive of the patient's wishes and give them the best choices possible.
Yeah, so what advice maybe would you give someone that's struggling with chronic pain who is concerned maybe about managing it without opioids?
Well, first of all, let's make it clear. When people are taking opioid as prescribed by physicians, they develop dependence, which is a condition when you cannot simply stop medicine because you're going to go to withdrawal. You have to wean off. It is not a scary condition. If you have a high blood pressure, you have to take blood pressure medicine, and you cannot abruptly stop it, and same with the diabetes, etc. Addiction is a psychological dependence that forces you to commit antisocial acts to get high with opioids. So maybe your concerns are can be overcome with a conversation, or maybe it's true you don't want to have opioids, but then we still have some options.
Yeah, so it's good that, we obviously don't want anybody addicted to opioids, and it's good that you are offering other options out there. And it seems like there's many options. And so if somebody wants to maybe call, can they just call the number that's going to be on the screen in just a moment for just to ask any questions or maybe make an appointment?
Yes, generally we request a referral. So from a primary care or specialist who involved in the care otherwise.
All right, that's great to know. Well, Doctor, I really appreciate you coming on today.
Thank you.
All right, well, don't go away because we have more when we return.